Welcome to the Private Practice Survival Guide podcast with your host, Brandon Seigel. I'm a published author, speaker, entrepreneur, and private practice strategist dedicated to transforming the way that healthcare functions. This podcast is all about empowering you to create the change you want to see. Let's dive in. Thanks for tuning back in. In this episode, we're talking about most common medical billing mistakes made by private practices. Now, before we jump into this, I want to give a couple disclaimers. The first thing I want you to recognize is that medical billing for most private practices, that is your fuel line. There is no money if you are not optimizing your medical billing approach. And there's a lot that go into medical billing. It's not just the actual claim submission. It's understanding payer rules, understanding procedure codes, understanding NCCI edits. It's understanding all the different variables that are impacted both from a payment model, a compliance model, but then there's also an aspect of this that's how are we creating our buy-in with patients? How do they understand that piece? And so I want you to almost think of this medical billing piece as the lifeline for you to keep the lights on in your private practice. And I get asked a lot of the time, like, hey, Brandon, how do I know if I should outsource it? How should I know when or if I should have it in-house? And the biggest thing I can tell you is it's actually not about whether it's outsourced or it is in your practice. It is about who can you tap into that is the highest qualified individual. I think one big mistake that a lot of private practices don't recognize is they go really cheap in this area. And they're like, oh, my receptionist says she has 10 years of medical billing experience. I'll be honest with you, I think 1 out of 1,000 people that actually say they do medical billing actually know medical billing. Anyone can send a claim. Anyone can take a procedure code and can run it through, an NCCI edit and submit it, but really understanding the nuances of medical billing, denial management, all of those different things, it's really critical. And I'll never forget, my wife and I were at a party once, and I'm really passionate about this RCM medical billing side. And the reason why I'm really passionate is because 20 years ago, I saw someone wreck my mother-in-law's practice. She stole money because of her laziness, tucking stuff and not doing a good job. And so this industry breeds, I'm sorry, lazy people. And I mean no disrespect, but I would say 9 out of 10 medical billing companies stink because they're offshoring it and they're only chasing the lowest hanging fruit. And so basically the expectation of what you get in medical billing, the bar is so low. And I'm a big believer that we should have people that are the PhD of thought. I think we should treat medical billing like we treat medicine. It is a science. And so I come back to this idea of navigating and finding who brings the highest skill set. Not who has the most experience even, who brings the highest skill set. And so we were actually at this party and my wife goes, hey, Brandon, I was talking to these 3 people and they're medical billers. You should go talk to them. I know you're in the medical billing business and you're always looking for top talent. So I'm like, okay, what do I have to lose? Let me talk to them. They're not medical billers. All they do is post payments. I mean no disrespect, but they're data entry people. I said to my wife, I said, when I start asking them, like, what are the CMS changes that they're seeing and how are they adopting it to urgent care and all these different things, they looked at me like, they're like, well, that's not what we do. I'm like, what do you do? They're like, oh, we just enter payments and post it to, I'm like, well, that's not medical billing. That is data entry. And so when you're looking at what your medical billing department looks like, or you're looking at who you're working with, really define what are the roles, what are the functions, what is the experience, what is the skill set. And so as we build this, I believe we can build an optimal medical billing solution both in your private practice or in partnership with your private practice. It's just a matter of what your needs are and where you can tap into the highest caliber talent. And One of the mistakes that I do see a lot of the time is when you're small, you outsource, and when you're big, you bring it in-house. And I actually like doing it the opposite. And the reason for this is, I'm just going to give you round numbers. If your practice is doing $10,000 a month of collections and you outsource it, that 6% you're paying, there's not enough revenue tied to 6% for me to actually work your claims. I want to put in 10, 15, 50, 60, 100 hours. I want to have 16 people working your practice, doing every single layer from audits to coding and all of that. And when you're small, you're not willing to pay $10,000 for medical billing. You want to spend $600. What's the product you're going to get for $600? It's going to be really low. So when you look at it, you're like, oh my God, I'm spending like 20 grand a month in medical billing. Well, do you know that there's 12 W-2 employees making 50 to 100 grand a piece? See, that's the other thing. This industry thinks it's $16 an hour people. It's not. It's 50, 60, 100. There are medical billers that I have that make 150 grand. Like, it is a true science. So as you're looking at your medical billing mistakes, as you're looking at these things, I want you to recognize that you need to tap into thought leaders. You need to tap into skill set. You need to tap into expertise. And so the top 6 mistakes that I'm seeing consistently is, first and foremost, benefit analysis. Private practices are overpromising coverage. They're underquoting expenses to patients. They're not utilizing an extensive quoting process, and they're relying on electronic checks that are not giving you enough data. They're not only not reliable, but they're not actually digging in to the benefit package. I believe there's 15 to 35 pages of content you must read when you really look at it. When you're looking at exclusions and coding and modifiers and the way that a plan works. And the problem is this: you're upset because as a private practice, you're like, I don't want to deal with this. I just want to deal with medicine. And my point is, the minute you contract with insurance, you're signing up for a Rubik's Cube of data. You got to be aware. And I get that we're getting into technology and AI, but I am seeing a lot of mistakes when we're relying on technology with not enough checks and balances. The second thing that I'm seeing really commonly, and I want to warn you to be aware, is I would say 7 out of 10 private practices that I do an audit for are upcoding without the appropriate documentation. And by upcoding, their clinical documentation's not supporting the codes that are being utilized. And when I'm auditing your practice, the practitioners are actually sharing that they're utilizing codes based on what insurance pays and dictates. The minute I come into your practice and someone says, I use this code because it pays more money than this other code, that's fraud. You need to utilize a code because it is the best applicable code. See, that's the biggest thing, is that we're trying to optimize the dollar amount. Insurance doesn't want you to make more money. So you have to make sure you understand the way that works. Now you can say like, oh, we're a free market, we're this or that. You're signing your life away when you sign these contracts. So understanding compliance, because when I come in and I do an audit, I'm like, this is all going to be retracted. You're like, what? I'm like, here you go, blah, blah, blah. And they're like, I wish someone told me. And I'm like, the problem is you don't know. You're putting your trust in people that don't know. And then what's happening is you're getting paid and you think the measure of compliant billing is based on what gets paid and what gets denied. It's not correct. And I say, even as an example, have you ever sent 2 claims identical? One gets approved, one doesn't. It kicks back this or that. So just because something gets paid does not mean you're doing it right, does not mean it's compliant, does not mean it's ethical. The third mistake that I'm seeing consistently is I'm seeing NCCI edits are not being checked. Private practices are not properly measuring the NCCI edits. They're not utilizing the right coding modifiers. They're not utilizing the right place of services sometimes. And there's major coding errors as a result. Very important. Kind of building off of that, I bring, so from NCCI edits, we're now going into also seeing issues with modifiers, issues with POS mistakes. And so even today, I was looking in one of my groups that I run, and someone wrote, I didn't recognize that when I utilize this specialty, there's a discount. I've been getting paid full. And I said, you've been getting paid full because you haven't utilized the modifiers. You're illegally billing. They're like, well, how was I supposed to know that? I'm like, that's why. Don't work with insurance and learn on the job. Either study it thoroughly or hire experts. Private practices are not coding modifiers correctly unless they get denials. And so what's happening is they think because something's getting paid, they don't recognize that just because it's paid, again, does not mean you're coding it correctly. And so I'm seeing issues where assistants and nurse practitioners are not being billed properly and all these different things. And so these errors are occurring. And the other thing that we're seeing major mistakes with is POS, place of service. I just audited a client that was not putting in the right modifiers or place of service for telehealth for over a year. And you know what they told me? They said, hey, I was advised by people on Facebook that this is what I should do. I'm sorry. I don't know why we're listening to Facebook. It makes no clarity to me. And granted, it would be really nice if insurance would spoon feed what you need to do, but they don't. So you need to look, you need to study, you need to have the right expertise to figure it out. The next thing I find is authorization management. Now, a lot of you recognize the issues with authorizations because that's a pretty black and white denial reason, but this is the easiest fix. And I am shocked how much money gets flushed down the toilet because of poor authorization management. Every time we audit an account and I see denials for no authorization on file, I literally go mad. I go mad because I'm like, this is money. Honestly, your employees should pay back wages if it was legal. There's no excuse for a denial based on authorization. None. Zero. Organization systems. Create your authorization management function. Stop scheduling patients when you don't have the right stuff on file. You prioritize the money in order to deliver the honey. I don't care. That is the requirement. We cannot afford to work for free. And I would say that when I audit denials, on average, 50% of denials are related to an authorization management issue. That's crazy. And then the sixth thing I want to tell you, which is a common mistake and something that I really think you need to look at, is you're not billing daily, especially small practices. You're batch billing, which means, hey, we bill every 2 weeks, or we bill every Friday, or we bill every other day. And when you are batching your billing approach and you're not billing daily, that's impacting cash flow. It's setting up bad systems, and it's honestly creating a disservice to a patient. Every single penny gets charged every day. Every patient should be paying every day. They come in 5 days a week, they pay 5 times. This batch piece, it's not working for you. I'm telling you, I see it every day, day in and day out. When I'm looking at the clients that I serve, I'm like, hey, and that's why I won't even take a client that will not work in that way, because the reason why I'm so regimented is consistency to prioritize your profit. Plain and simple. Consistency will allow us to prioritize your profit. So here are some additional deficits that I'm seeing. So when I'm seeing like denials and issues, et cetera, especially as practices grow and you're bringing in inferior administrative support. And again, I come back to, if you're paying less than $18 an hour, even in the middle of Oklahoma, like I gotta look at like, what is that quality? The $12, $15 an hour employer, are they able to get it done? And so whether it's onshore, offshore, whatever, we're seeing a lot of issues with incorrect and incomplete patient information. We're seeing mistakes with entering wrong demographic details, the wrong name, the wrong date of birth, the wrong insurance ID, failing to verify eligibility. Claims are rejecting just due to mismatches or expired coverage. these are so easy to fix and be proactive. So I want you to make sure that you're implementing not only real-time verification, but that you're cross-checking every single data entry piece in multiple ways to make sure it's clean. And that you're not just making sure that your patients are actually signing off on the data being accurate in your practice management software. The other thing that we're seeing as a common mistake is we're seeing unbundling of services. So we're billing separately for procedures that should be bundled, especially when it's like hospital, especially when it's physician-based practices. Sometimes you're not billing correctly, your surgeries and whatnot. So we're seeing a lot of denials and even accusations of fraudulent billing because of that bundled and unbundled approach. And so you need to use software, and experts, AAPC certified coders can help you to make sure you're flagging unbundling errors and that you're training your billing rules correctly. You're setting them up accurately. Another issue that is pretty frequent that we're seeing is inadequate documentation. You know that I've audited documentation where literally I've seen physicians, nurses just pull it forward, and they forget to even change. And so two notes mirror each other. Providers failing to document the medical necessity, detailed visit notes, having evidence-based documentation for what codes are being billed. We're seeing a huge denial rate when we're running audits on the inability to appeal rejections just based on this. And so we want to educate our providers. We want to make sure we're documenting effectively in each note, and we want to perform pre-billing chart reviews. We want our team and our doctors and our nurses to go through a documentation chart review and having pre-billing reviews to make sure that we're documenting appropriately. Another common mistake that we're seeing, delayed claim submissions. And I kind of mentioned this before, but I've seen that we're even holding claims when someone's not credentialed. And I'm like, well, why are we bringing people in before they're credentialed? And so we're submitting claims sometimes past payer deadlines. We're seeing timely filing mistakes. And obviously that's automatic denial, lost revenue. You should not have timely filing delays or issues. So we want to make sure we're submitting daily. We want to be using the right clearinghouse tools. We want to make sure we have the right credentialing in place. We want to make sure that we understand the rules of credentialed providers versus supervised providers and how each insurance contract functions. And we want to prevent holding back claims, especially if some insurances don't allow you post-dating claims, et cetera. And so they won't allow you to, or predated, et cetera. So you want to look at all those things. The other thing I'm seeing a lot is your billing teams are not following up on denials accurately. Every day they should be working denials. And so what's happening is they're like, oh, every other week I'll work denials, because denials take time. Denials take research. Denials are not easy. Get the button pusher out of your business. Denials require work, and ignoring denials or rejected claims or failing to appeal claim denials within deadlines, you're shooting yourself in the foot. Again, lost revenue, missed opportunity. We're not correcting the errors. And so I want you to assign a denial management team. I want you to categorize denials by reason. I want you to set appeal deadlines. And I want you to do this. Okay, you ready? Any denial that is a direct reflection of an employee's policy breach is a write-up, and 3 breaches will put them on restriction, and they will not be eligible for bonuses or anything else. So what I want to give you an example of is, if you get a denial because of no authorization, your authorization clerk should get a write-up. If they get 3 of those within a 90-day period, they should be put on probation with no benefit, no bonuses, no raises, no nothing within a 6-month period of perfect completion. And I know you're like, Brandon, mistakes happen. I'm like, we need to prioritize. And there are things that we can be pretty perfect at. And that's why it takes 3 to get on my list of issues. For the past 20 years, I've had the privilege of helping pediatric occupational, physical, and speech therapists redefine the way that their business functions. and helping them tap into their entrepreneurial spirit. In recent years, I recognized a deficit, which was bringing private practice owners together with the vision of allowing them to connect, learn, and grow. And Growth Code Conference was born. From sunrise to sunset, we offer an opportunity for pediatric, occupational, physical, speech therapy private practice leaders and owners to connect, collaborate, learn, grow from yoga to breakfast to lunch to coffee carts and more. We take you to another world where you are inspired, where you feel empowered, and where you are able to grow to the next level so that we all can change the world one child at a time. The other thing that I would look at is like, if you get a denial or a rejection because of documentation errors by your provider, again, if they have 3 of those, I would treat them the same way. If your denial management team is not working daily and you find that you have a timely filing miss, same thing. They should be on probation. These are all things that can get easily fixed, and we need to put accountability on our team who are doing that. For me, I run a 30-day, you can break up with me. And the reason for it, people are like, oh my gosh, like, aren't you worried? I'm like, if I don't earn their business, I don't want them because I'm not worthy of that business. And same fold, if they're not doing their job, I can break up with them too. So if I have a client that is responsible for their own authorizations and they're dropping the ball, do you think I'm going to keep them? No, they're taking money out of my pocket too. So it's really important that we look at that. Another deficit that I'm seeing is billing for non-covered services. We're submitting claims for services that are not covered by insurance. We're hoping that we can get it applied to deductibles or whatever, but they are literally non-covered services. This could be experimental treatments. This could be cosmetic procedures. This could mean there's exclusions, and the denials and patient dissatisfaction occur, and it is not a smart move. So you got to do your eligibility checks and informing patients of the worst case scenario, explaining what a covered service is, what a covered service is not, and how sometimes it takes some time in unique circumstances to identify what are non-covered services based on exclusions, etc. The next common deficit I'm seeing is poor patient collection practices. We are seeing people that are not collecting copays, deductibles. They're waiting for EOBs to post. Don't wait for EOBs. Anyone that says, I don't know what to charge until I get the EOB, I'm sorry, they don't know how to be a biller. Our job is to forecast, project, and I can get it within 10% accuracy, and it's always easier to refund versus collect. And so when your staff says, we don't know what to charge, send them back to billing school. I'm sorry. AAPC, get their certifications, build their knowledge, put your money where your mouth is, and be a professional. That is why we pay the big bucks for these people. These $12, $14 an hour receptionists that become billers, and I know I'm hard on this, but they're destroying our industry. So my passion's coming through because just like you don't want a doctor to tear down your industry, I'm tired of billers, lazy billers making our industry bad. There is no reason to not collect 100% of patient responsibility at the time of every visit. Their copay, their coinsurance, their deductible. When patients pay, we protect them. When patients don't pay, we create a leveraged situation which can make it hard. I used to see this biller that said, I do a service to my clients. I don't collect from them until the insurance has processed everything. I'm like, yeah. And then 16 appointments later, you try to collect $3,800 and it puts that person in a really tough place. They're not able to budget. Do not treat a patient without collecting their full allowable. It's so funny because I will sometimes go into a practice and they're like, oh, we're going to bill your insurance and we'll see what they cover. And I'm like, would you like me to do your job? I can tell you what I'm going to have to pay if you'd like. And they're like, oh, really? I'm like, yeah. This is a disservice to your patients, whether they know it or not. You think it's a service because you're like, oh, I'm giving them time. Every day that goes by that they collect money owed to you is money that they may not have in their bank account. And that's why I drive people crazy, but the minute I know I owe someone, I want to pay them. Don't give me net 90. I want to pay you now. I do not want to wait till a day where I'm like, I owe them money, and what if I spend too much? Balancing your books up front is so important. Once we are running a clean AR, we still need to review our EOBs. And I find a lot of practices, once they get paid in full, they don't actually look at the EOBs, the explanation of benefits. Failing to reconcile EOBs with claims can identify underpayments or incorrect adjustments. There's a lot of things that insurance makes mistakes on, and we have to be able to look at that, because those unnoticed payer errors can be the death of your practice. You're leaving money on the table. So assign your staff to review EOBs weekly, appealing underpayments promptly. So here's going to be a tip that some of you might like, some of you might not, and I kind of alluded to it, but I want to kind of beat it down a little. It is easier to collect patient responsibility at the time of service than waiting for the explanation of benefits. And so I just want to reiterate, do your due diligence, collect patient responsibility up front. That's coinsurance, that's deductible, that's even if you anticipate a non-covered service, making sure that you're in guidelines of your insurance contract. I'm not telling you to collect anything that you're not allowed to collect. What I'm telling you to collect is what is the anticipated patient responsibility. I'd rather refund you later. I'd rather collect based on clear data and projections than not collect. See, the thing is, insurance is like, oh, they want to do right by their client. But when their client doesn't pay you, they don't care. They're like, that's between you and the patient. So it's really important that we prioritize, and we know, because no money, no mission. So we need to have one-to-one financial accountability meetings. We need to spend the time and coach the perspective to our patients on financial responsibility. We need to make them understand worst case scenarios. We need to ask them if they can budget for all these out-of-pocket costs. Do you have the money for the service? We need to prioritize that with them. When allowed, we need to have credit cards on account. We need to have automatic processes. They should be PCI compliant, stored. We should be producing good faith estimates. We should be producing insurance resource guides. We should creating the financial budget agreement and accountability clause. And at the end of the day, I want them to know, just like if you didn't pay a bill on your house, you'd get foreclosed on. I'm going to foreclose on you. I need this. This is how we pay our bills. We do not rely on just insurance. We rely on patient payment. And so setting that foundation is really important. It's also important to look at our medical billing workflow. So we need to streamline the way your medical billing workflow functions. Be careful of AI in which wrong data can be missed. Run your medical billing process on a daily basis with 3 lenses: data processor, data auditor, strategic auditor. Standardize your coding practices for consistency. Train your staff. Utilize NCCI edit softwares. Utilize a documentation audit process. Ensure medical necessity is clearly defined as it relates to the procedure descriptions, and documentation is correlated. Don't be afraid to get utilization management involved from the insurance company when errors are consistent. Categorize the denials by reason. Utilize a streamlined appeal process. Ensure insurance errors are being fixed on a utilization management level. And so we need to be proactive. And so analyzing is part of our process. So we're going to conduct regular audits. We're going to perform monthly internal audits of claims, identify coding errors, underbilling, overbilling, hire external auditors, ensure compliance with CMS and payer guidelines, randomly sample 10 to 20 charts to provide and catch discrepancies, analyze your payer trends, predict revenue gaps, and identify coding optimization. You know, MGMA has some incredible benchmarking. AAPC has some incredible auditors. There's plenty of resources out there for you. And so I want you to monitor your patient demographics, analyzing any insurance mix, any shift, making sure the data is staying accurate. I want you to leverage predictive analytics. I want you to implement tools that are helping you predict denial risks based on claim patterns and payer behavior. Using that can really help you. You need to stay ahead of regulatory changes. You need to subscribe to the newsletters and all the different factors, and go to some of these workshops. Even if you have billers, you should be in the know. And then you need to engage in continuous improvement. This never stops. And so one of the things we forget to do is we contract with insurances, but we don't build strong payer relationships. You need to establish direct communication channels with your payer representatives. You should assign a dedicated staff member to act as the liaison with every single major payer. Schedule quarterly meetings with your payer reps. Discuss contract terms. Discuss policy updates. Discuss the reoccurring claim issues that are happening. This is going to help you become proactive, and sometimes you're able to negotiate favorable terms because of the way that you are proactive in these relationships. Optimize your claim submission with payer-specific strategies. Tailor each claim to each payer's preferences. Having those billing rules is really important. We need to leverage advanced analytics for payment predictability. Did you know that there are tools out there that you can actually predict where risk is based on diagnostic and some of those tracking and benchmarks that can happen? And then we have to enhance our payment recovery process. We have to look at what are our robust recovery systems? How do we build, train, and optimize different things? And whether you're using like a TriZetto or an Availity, they have ways for you to measure these underpayments and these overpayments. Maximize value-based alternative payment models, looking at the way that you're using joint sponsor, ACO, bundled payments, different things like that. There's more ways than you know, and optimizing things like the MIPS and the MACRA and all different reporting that can help you generate optimum payment in your approach. And so as we look at this, we're going to strengthen our compliance so that we can avoid payment disruptions, conducting proactive compliance audits, preventing payment holds, preventing retractions, etc. And then we need to engage patients to support insurance payments. We need to make sure our patients are advocates with us, working with payers, working with insurances, working with all the different people so that together we're optimizing not just their care, but their collectibles. And so that's going to allow us. And then obviously you need to outsource strategically. And so consistency is the key. When you're outsourcing because you're getting a greater product for your money. And I want to say that again, that you're getting a greater product for your money. So, did you know a 2023 MGMA report indicated that 82% of medical billing errors in private practices are due to incorrect coding mistakes costing an average $130 a claim in lost revenue. So in the words of Robert Collier, success is a sum of small efforts reported day in and day out. Thank you so much for tuning into this episode. Don't forget to like us, subscribe, reach out, be part of our community, because together we can thrive, not just survive. Thank you for tuning in to the Private Practice Survival Guide podcast. I'm incredibly grateful to each and every one of you. Exciting news. We're now available everywhere, from Spotify to Apple Podcasts to YouTube or anywhere you like to listen to your podcasts. So watch, listen, and reach out. If you love this episode, please drop a 5-star review. It truly means the world to me. Are you looking for more ways to elevate your practice? If so, now is your chance. Reach out, go to my website, or email me at brandon@wellnessworksmp.com. And remember, it's not just about surviving, it's about thriving.